Health pioneers present chronic allergic immune condition of the esophagus. If you are new to this channel, hit the subscribe button and turn on the notification bell for more relevant health topics. Eosinophilic is a recognized chronic allergic immune condition of the esophagus. The esophagus is the tube that sends food from the mouth to the stomach. In EoE, large numbers of white blood cells called eosinophils are found in the inner lining of the esophagus. Eosinophils can release substances into surrounding tissues that cause inflammation. Normally there are no eosinophils in the esophagus. A person with EoE will have inflammation and increased numbers of eosinophils in the esophagus. The chronic inflammation of EoE leads to symptoms. The symptoms of EoE vary with age. Infants and toddlers may refuse to eat or not grow properly. School-age children often have decreased appetite, recurring abdominal pain, and trouble swallowing or vomiting. Teenagers and adults can have the same symptoms, but often have difficulty swallowing dry or dense, solid foods. The difficulty swallowing occurs because the esophagus is inflamed, and in severe cases, because the esophagus narrows to the point that food gets stuck. Food firmly stuck in the esophagus is called a food impaction, which can be a medical emergency if the food does not go down the esophagus into the stomach or is not vomited up relatively quickly. Diagnosing eosinophilic esophagitis. Currently, performing an upper endoscopy with biopsies of the esophagus is necessary to diagnose EoE. An endoscopy is a medical procedure where a flexible tube containing a light source and a camera lens is passed down the esophagus so your doctor can see if your esophagus is inflamed. Small pieces of esophageal tissue the size of the tip of a pen, biopsies, are taken to be examined under the microscope for the presence of eosinophils and for signs of inflammation. Eosinophilic esophagitis treatment. Food test-directed elimination diets. If you are noted to have specific food sensitivities after prick skin testing, your doctor may remove specific foods from your diet to see if there is a reduction in EoE symptoms. In some individuals this helps control their EoE, though this type of diet has not shown to be very successful in research studies. Empirical elimination diets. Eliminating the major food allergens from the diet is considered an acceptable treatment of EoE. The foods excluded usually include dairy, egg, wheat, soy, peanut, tree nuts and fish, shellfish. These diets have been shown to be very helpful in treating EoE, although they can be very difficult to follow, especially without the help of a dietitian with experience in dealing with EoE. Foods are typically added back one at a time with follow-up endoscopies to help determine which specific foods are causing EoE. Elemental diets. In this strict elimination diet, all sources of allergens are removed from the diet. The patient receives their nutrition from an amino acid formula alone or sometimes while allowing 1 to 2 simple foods chosen based on their low likelihood to trigger EoE. All other foods are removed from the diet. A feeding tube may be needed in very young children treated with this diet, since they are often unable to drink enough of the formula to get adequate nutrition. This approach is generally reserved for children with multiple food allergies who have not responded to other forms of treatment. Medical therapy. No medications are currently approved by the U.S. Food and Drug Administration (FDA) to treat EoE. However, medications have been shown to reduce the number of eosinophils in the esophagus and improve symptoms. Proton pump inhibitors (PPIs), which reduce acid production in the stomach, have also been found to be able to reduce esophageal inflammation in some patients with EoE. Thus, PPIs are often used as a first treatment for EoE. Working with your doctors. EoE is a complex disorder. It's important for patients to listen to their gastroenterologist for advice on managing EoE and figuring out when endoscopies are needed to check to see if the condition is getting better or worse. Patients also need to work closely with their allergist/immunologist to find out if allergies are playing a role. An allergist/immunologist will also be able to tell if you need to avoid any foods and can help you manage related problems like asthma, eczema and allergic rhinitis. It is important that your gastroenterologist and allergist work together and agree on how to take care of your EoE. If you are following a diet to treat your EoE, working with a dietitian who knows about elimination diets used to treat EoE is highly recommended. Thanks for watching. Please like and share this video.